everyone! Welcome to our channel, Canadian Nurse Expert. In this video, we will dive deep into fluid and electrolyte balance. Question number 1. A patient is admitted with dehydration. Which clinical sign is the most reliable indicator of fluid status? Options are skin turgor, daily weight, blood pressure, heart rate. The correct answer is daily weight. Daily weight is the most accurate indicator of fluid balance as it reflects real changes in total body water. Other options may provide clues but are less reliable. Question 2. A patient with prolonged vomiting is most at risk for which electrolyte imbalance? Options are hypokalemia, hyperkalemia, hypernatremia, hyperkalemia. The correct answer is hypokalemia. Vomiting causes a significant loss of potassium, leading to hypokalemia. Sodium and calcium are less affected, and hyperkalemia is unlikely. Question 3. The nurse knows that a sodium level of 150 milliequivalents per liter is classified as options: hyponatremia, normal sodium level, hypernatremia, sodium imbalance unrelated to symptoms. The correct answer is hypernatremia. Normal serum sodium levels range from 135 to 145 milliequivalents per liter. Levels above 145 milliequivalents per liter indicate hypernatremia, which often results from dehydration or excessive sodium intake. Question 4. A patient's lab results show a serum calcium level of 7.5 milligrams per deciliter. Which clinical finding is most consistent with this lab value? Positive Chvostek's sign, muscle weakness, lethargy, bradycardia. The correct answer is positive Chvostek's sign. A calcium level below 8.5 indicates hypokalemia, which causes neuromuscular excitability, manifesting as positive Chvostek's and Trousseau's signs. Question 5. A patient receiving a loop diuretic is at risk for which electrolyte imbalance? Is it hyperkalemia, hypokalemia, hyperkalemia, or hypermagnesemia? The correct answer is hypokalemia. Loop diuretics increase potassium excretion, causing hypokalemia. They may also reduce calcium and magnesium, but do not lead to hyperkalemia or hypermagnesemia. Question 6. A patient with diarrhea for 3 days is at risk for which acid-base imbalance? Is it metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis? The correct answer is metabolic acidosis. Prolonged diarrhea causes the loss of bicarbonate, leading to metabolic acidosis. Other forms of alkalosis or acidosis are unrelated. Question 7. A patient has a potassium level of 2.9 milliequivalents per liter. Which ECG change is most likely? Options are peaked T waves, prolonged PR interval, depressed ST segment, shortened QT interval. The correct answer is depressed ST segment. Hypokalemia, which is less than 3.5 milliequivalents per liter, often causes a depressed ST segment, U waves, and flattened T waves. Peaked T waves are associated with hyperkalemia. Question 8. Which symptom is most indicative of hypermagnesemia? Is it hyperreflexia, hypotension, positive Trousseau's sign, or tetany? The correct answer is a hypotension. The rationale behind this is that hypermagnesemia depresses the central nervous and cardiovascular systems, leading to hypotension, bradycardia, and muscle weakness. Hyperreflexia and tetany, on the other hand, are associated with hypocalcemia or hypomagnesemia. Question 9. A patient with SIADH is most likely to exhibit which laboratory finding? Could it be serum sodium of 125 milliequivalents per liter, serum osmolality of 300 milliosmoles per kilogram, urine-specific gravity of 1.005, potassium of 5.5 milliequivalents per liter? The correct answer is serum sodium of 125 milliequivalents per liter. The rationale here is that SIADH leads to dilutional hyponatremia, which means low sodium due to water retention. As a result, serum osmolality decreases and urine-specific gravity increases. Question 10. What is the priority nursing action for a patient with a calcium level of 6.2 milligrams per deciliter? Options are: administer IV calcium gluconate, monitor for bradycardia, encourage oral calcium intake, or prepare for dialysis. The correct answer is administer IV calcium gluconate. The rationale is that severe hypokalemia, which is less than 7 milligrams per deciliter, requires immediate treatment with IV calcium gluconate to prevent life-threatening complications such as laryngospasm or seizures. Question 11. So, a patient receiving total parenteral nutrition, or TPN, develops confusion and tremors. Which electrolyte imbalance should the nurse suspect? Your options are hypophosphatemia, hyperkalemia, hyponatremia, hypokalemia. The correct answer is hypophosphatemia. This is because refeeding syndrome during TPN administration causes hypophosphatemia, which affects neuromuscular and central nervous system function, leading to confusion and tremors. Question 12. Which of the following findings is most likely in a patient with hyperkalemia? Options are muscle cramps and weakness, positive Chvostek's sign, Trousseau's sign, tetany. Correct answer is muscle cramps and weakness. Hyperkalemia increases neuromuscular irritability, leading to muscle cramps, weakness, and potential paralysis. Chvostek's and Trousseau's signs are associated with hypokalemia. Question 13. A patient with diabetic ketoacidosis, also known as DKA, is receiving insulin therapy. The nurse should monitor for which complication? The options are hypokalemia, hypernatremia, hypermagnesemia, metabolic alkalosis. The correct answer is hypokalemia. Insulin therapy shifts potassium into cells, lowering serum potassium levels and causing hypokalemia, even if initial levels were normal or elevated. What is the best intervention for a patient with a serum sodium of 119 milliequivalents per liter? Options: restrict oral fluid intake, administer IV normal saline, administer hypertonic saline as prescribed, encourage increased sodium in the diet. The correct answer is administer hypertonic saline as prescribed. Severe hyponatremia, which is less than 120 milliequivalents per liter, requires careful correction with hypertonic saline to prevent complications like cerebral edema. Fluid restriction is often used for mild cases. Question 15. A patient with acute renal failure develops a phosphorus level of 8.0 milligrams per deciliter. Which nursing intervention is most appropriate? Options are: administer phosphate binders, restrict dietary potassium, increase calcium supplementation, encourage oral hydration. The correct answer is administer phosphate binders. Hyperphosphatemia in renal failure is managed with phosphate binders to prevent complications such as hypocalcemia and metastatic calcifications. Please like, subscribe, and share this video if you found it helpful. Thank you for watching.